What are the main differences with upper cervical and full spine chiropractic? As you may have guessed from the name, full spine chiropractic focuses on the full spine, whereas upper cervical chiropractic is focused on the top part of the neck, what we call the cervical spine, that's your neck, and we're looking more at the top two bones, particularly the ones we can see just here and the one just below it, just here. The reason we focus in that area is because that's where there's a more neurological component, which some full spine chiropractors may not focus on quite as much. And this can affect certain conditions which may be more fitted to upper cervical chiropractors, like dizziness or migraines. Number two is going to be the level of training. Almost every single chiropractor is going to have a comprehensive knowledge of how to deal with full spine issues from their university or their college. However, for upper cervical chiropractors, this is usually extra courses they do postgraduate or while they're still in university, external to the normal syllabus. Next will be the most common conditions or symptoms that may be seen in each practice. For full spine chiropractors, things like low back issues, maybe some shoulder impingement issues, hip issues, they're going to be really good at this. Upper cervical chiropractors, it's going to be more neurological issues. So things like dizziness, vertigo, migraines, facial pain, headaches, or maybe even some symptoms going down to the arm, hand, or fingers. Another difference is going to be the testing and the protocols. Usually in terms of x-rays for full spine chiropractors will be usually of the full spine, whereas for upper cervical, we're going to focus just on the neck. And we also use what we call nerve scans. You may see these in some practices, even full spine chiropractic practices, but they may not be using them the same way as you would see in an upper cervical chiropractic practice. And this really lets us know how patients are progressing and lets us know when we should or should not be adjusting. In upper cervical chiropractic practices, we may even use different benches or equipment, such as here we use a knee chest. This is something you may not see in a full spine chiropractic office. Due to the different equipment and techniques that we use, it's generally much more common that you may not hear a pop or a crack sound during an adjustment. These are some of the common differences between upper cervical and full spine chiropractors. Both have value, both can be very helpful for patients. If there's anything you think I've missed, drop it down in the comments.